Good afternoon, everyone. Welcome to the Institute for Healthcare Advancement's live national interactive social media event, Stories and Lessons from the Intersection of the Affordable Care Act and Health Literacy. I want to welcome, first of all, everybody who is here at the conference in our auditorium today. And I also would like to welcome everybody who is watching the live webcast of this event on the internet. The purpose for our event here today is to share some of our stories, share some of our successes, some of our brilliant ideas, some of the things that help us to advance the understanding, the application, and the implementation of the Affordable Care Act, but we're specifically looking at that through a lens of health literacy. The Affordable Care Act is a piece of legislation that is a groundbreaking legislation. It's brought healthcare insurance to many, many people who had not had access to health insurance before. However, health insurance literacy is an issue that we're going to be talking about today because people's ability to not only understand the language and the terminology, the jargon of health insurance is rather limited. It also really spreads across all aspects of implementing these areas of healthcare. Not only is it difficult for people to understand the concepts of signing up for health insurance, getting enrolled, and understanding some of those things on the front end, but once you're enrolled, all of a sudden there's this great big gap, this great big lack of knowledge for people who have never had health insurance. How do I use this policy? And we're going to hear some stories today from people who have addressed that, both on the front end, the enrollment end, as well as some ideas for implementing some programs to help people understand how to actually use that health insurance policy. So what I would like to ask, first of all, for the people who are in the audience, at some point we're going to be drawing stories from essentially three sources. We have asked people to submit some videos to us to talk about some of their experiences here, and we're going to share some of those videos. We would like to invite people who are in the audience who have a story to tell to step up to the microphone here and share those stories with us. And then for those who are watching the webcast, you can either tweet some information about some experiences that you've had, or on your screen as you're watching back at home, there is or in your office, there is a chat function, and you can type in a very short story or anecdote or something, and if we have time, we'll get to all of those. We will be archiving this session on our website, www.IHA4health.org, and that's the number 4, IHA4health.org, and sometime by the end of next week, you should be able to access all of that information. I wanted to introduce my co-moderator, Dr. Katina O'Leary. She is the CEO of Health Literacy Missouri. She'll be sharing some insights on this topic, as well as some things that Health Literacy Missouri is doing. And I also want to thank Michelle Roberts from Health Literacy Missouri, who is helping us with some of our social media aspects on all of this. And I also want to thank the Hotel Irvine for sponsoring the lunch. Those of you who are here are enjoying a nice lunch, and that's courtesy and compliments of the Hotel Irvine. So our thanks to them as well. So I think what we'd like to do is start off with one of our videos. And this first video is from Donna Orban, and she's with the Community Services Council of Tulsa. And let's watch the video, and we'll have a comment or so after.
Hi, this is Donna Orban from Oklahoma. I'm a navigator. One thing that impacted health literacy in Oklahoma was our Native American population, with the second largest Native American population in the country, and only having 0.3% of natives enroll. Obviously, there was a huge lack of knowledge for the benefits under the ACA to the Native American population. They could get comprehensive care, and I don't think that they knew that. They are relying on IHS, which is not comprehensive care. I just think that we need to do a better job in getting the word out of what the benefits are for the Native American population to enroll.
So one of the things for this particular video that I find very interesting, there's an awful lot of parallels here in terms of what we might call some hidden populations. Those individuals where as the Affordable Care Act is being rolled out, we have a sense that, oh, this group is covered, this group is covered, those guys are all taken care of, we have to look over here. Where really, from what Donna was sharing with us here, there's an awful lot of people where we may have the impression that they are already insured, covered, have access to primary care, have a medical home, and all those services are provided. When in fact, that's not necessarily the case, as she says here. There's a very interesting parallel. IHA is part of we're here in Orange County, California, and we are part of a collaborative called Covered OC. And the mission for that collaborative is, it's a group of all the agencies that are working to enroll people in the Affordable Care Act, insurance under the Affordable Care Act, or Medicaid, Medi-Cal as it's called here in California. One of the groups that we work with, there's a gentleman by the name of Sid Gardner, who's the Executive Director of Children and Families Future. And he works with the families of veterans. And that's another group very similar to the Native American population, where we think, oh, veterans, well, sure, they have the VA, they have access to those healthcare services. When in fact, if you're on active duty, yes, very much so. You, as an active duty service person in the military, have access to health care, as does your family. However, once you're discharged, those family members are no longer covered, and it's a very tough to reach population. And so one of the challenges that we face as groups, individuals, trying to enroll people in the Affordable Care Act or in Medicaid, is being able to identify those groups, kind of invisible groups, and actually reach out to those individuals. And not only that, but also to get them to understand the whole aspect of health insurance and how that actually works as well.
So as I was just listening to the video, I was really taken back to some of my social work education. I'm a social worker by training. And one of the things we learned in social work school is, there are all of these factors for sensitive populations and vulnerable populations that are different than other people. And this focus on the Native American population in particular, without really a firm understanding of the cultural sensitivity and the differences in the messages, I think is kind of a failure of where we are with rolling out this plan right now. I think that for many vulnerable populations, and this might be an example, there's this idea that, yes, there's this wonderful health insurance opportunity, but that's not necessarily for me because I'm in this other group. So how do we extend the message that this is for you, that we need you, and we want to ask you, and we want to make sure that you understand it, and we want to make sure that culturally it fits with what you know and what you do. And I think that's an issue, obviously, for the Native American populations in certain places, but there really are a tremendous number of populations that have the same issue. In Missouri, we have the Cover Missouri Coalition. It's very much like Covered OC. And we're serving a bunch of communities, but the rural communities in our state, particularly in the lower part of our state, haven't really joined in the same way, so their enrollment numbers were much lower. And when you go out to the providers and the organizations that are involved in even our Cover Missouri initiatives, it's just harder for them to get to the meetings, it's harder for them to interact. When you talk about kind of the critical mass of CACs and navigators to help people enroll, they didn't have the same numbers, and they weren't able to disseminate the message in the same way, and they weren't able to connect like people were in urban communities. So maybe some of those same problems.
And especially when we're dealing with those particular populations, we know from a lot of the research that's been done that those underserved, disadvantaged populations, those that are experiencing those real health disparities, are not only tougher to reach, but then once we do reach them, their health literacy, their health insurance literacy levels, as a group tend to be much, much lower. So getting the message out to them to say, this is a requirement, it's also a remarkable benefit, having them understand the process of enrolling, and then, as I said, once they've actually enrolled, being able to effectively utilize those policies, which we're going to talk about some of the programs in a little bit that we've done there. It is a real challenge, and being able to get that information across. Do we have anybody in the audience who has come across a similar situation where they are working with a real kind of a underserved population and have had some challenges in terms of dealing with some of those. Okay, think about that. We want to encourage everybody who's in the audience, if you have a story, to at some point step forward to the microphone and do that. Go ahead and do that so we know that you have a story to share, so we can get back to you shortly. Okay, I think we're going to go to another video here. This next one is from Mara Williams, who works locally here in Orange County at UCI, University of California, Irvine Health, and she's going to share a story for us.
Hi, my name is Mara Williams, and I'm the Health Education Specialist for the University of California, Irvine Health. Each fall, UC Irvine Medical Center Patient Education Department hosts a flu clinic to provide free flu shots to our community at large. Last October, we had an Affordable Care Act covered California registration table at our health fair to provide information and enroll people for health insurance. We had a community member who had attended our flu clinic before come up to me and ask about getting insurance because she had just found out that she was pregnant. She knew we were offering this service at our health fair because she saw it promoted on our flyer and on Facebook. She was prepared and brought her financial paperwork that she needed to get enrolled. We walked right over to the Covered California table, and the kind representatives got her enrolled for health insurance at our health fair in less than 30 minutes. We were all so excited for this young woman, and we were thrilled that the process went so smooth and easy for her. Plenty of other people got information about enrolling in Covered California, but she was our biggest success that day.
Okay, so that's there's a great example of a success story. And when we are doing our outreach efforts, sometimes you are able to bring in a few more people if you can pair up your efforts with some other efforts. So in this instance, this was a community health fair. And during that community health fair, they were able to offer the enrollment option there. There's a number of other opportunities for these sorts of things during community education types of programs. If you're a licensed community health center, FQHC, when people are coming to get their primary care, any of those kinds of things. Katina, can you think of any other sorts of examples where you could pair up some events with other ones and actually be able to get a few more people involved?
So our Covered Missouri Coalition meets monthly, and last month at our meeting, we had about 30 tables of people, so 10 top tables with about 30 10 top tables, so about 300 people, and we left a set of questions on every table asking people for feedback. We just closed the open enrollment period. We didn't know about our numbers yet. We had kind of a sneaking suspicion that we did better than we were supposed to, but we didn't know yet. We found out about a week later that we did 29% better than the federal goal, so we were really happy in Missouri. But it was a hard time, and so we had about 300 people sit with these questions about kind of what were their challenges, what were their real successes. And I got that data this week, and I spent about two days kind of coding some of the early data just to understand it. And that's exactly what people talked about. These 300 people talked about being able to have convenient times, convenient locations, go where people are, meet with other people, and be really thoughtful about places that people use. So this idea of kind of making it culturally acceptable, easy, convenient. They talked about going, of course now we're looking at the special enrollment periods, and so there's this idea of, hospitals when people are having babies, OBGYN offices, marriage license offices, divorce attorneys, all kinds of things where people are thinking about life-changing factors that are going to put them in a situation where they are suddenly qualified. And so we're moving forward with materials for those things, but then also in the regular enrollment period, when open enrollment begins again, thinking about where really are kind of critical masses of people. You can get them when it's comfortable and convenient, and they can come back again and again, so that they don't have to make a decision right then, but they can maybe get comfortable and get acclimated. So those are the things we heard.
Great, excellent. We have a person in the audience who's here to share a story. Please step up to the microphone, let us know your name, where you work, and share your story.
Sure, definitely. My name is Amy Williams. I'm the lead health educator at San Francisco State University. And we had a couple success stories actually at our university. We became an enrollment entity in the fall, and we're the only CSU system that's an actual enrollment entity that enrolls students on site. Excuse me. And we found that was extremely very effective at getting the college-age population by having actually somebody on site, which was me. I'm not trying to brag, but I was an enrollment counselor. But it definitely really enables students to be able to come at their time while they're on campus, and also to bring some of their parents. So in addition to that, we were teamed up with the Cal State University ACA Health Information HIEP project. They had a grant. So in addition to having an enrollment counselor on site, we also had 2 students that were outreach educators. So what was really great is they would go into classrooms and give students a brief overview about Cover California, the health education, or California enrolling in health insurance, and then they would be able to collect emails, follow up with them, give some of the emails to my intern who could ask basic questions, and then send people to me for enrollment. So we actually had this whole interesting little structure where we were able to capture a lot of students, in addition to community members and alumni and actually some staff on campus. Another event we had was with a local congresswoman's office who decided to hold one of her events on campus, Jackie Spear, and so we were actually also able to bring in other enrollment counselors so that we could try and get as many people as possible.
So Amy, while you were doing those things, were there any recurring themes in terms of people going through that enrollment process and stumbling on or having difficulty understanding specific issues? Anything that was a real recurring thing, and if there was, did you have a way of sort of addressing some of those issues?
So one issue, a lot from the community members that I had when they would call my office phone would say, I'm a really intelligent person and I don't understand how the heck to enroll in health insurance. How do I navigate this website? I don't understand what's going on. So a lot of it was just being able to listen and answer questions and trying to explain what some of the lingo meant. The main common question I got from students was they would receive a letter in the mail, so they went through the whole online process and it said they qualified for Medi-Cal. And then they would receive a letter in the mail that said, you do not qualify for premium assistance, tax credits, a silver thing, and then on the bottom it says you may be eligible for Medi-Cal. So that one letter brought so many students in who even may have enrolled on their own going, I don't understand, I thought I qualified for Medi-Cal. And I'm looking at the letter going, it was just reworded in a completely different way. It would have answered all the questions. So that was the main thing I was having with students. And then the other issue was there wasn't a whole lot of questions or were not a lot of answers on the website about what to do with students who are in school full-time and don't have an income, but they may be getting scholarships and grants, and so how do you add that into income? And also students who are still dependent on their parents' taxes and how they enroll. So we had a lot of students very confused. Well, my parents still pay me this year, but I don't know if they're going to pay me next year. And so it was just very overall confusing, but that one letter was the main question on.
Thanks for sharing that, and I think this really brings up a very good point. I'm going to ask Julie McKinney to come up in just a couple of minutes, but for those of you who have worked in the field that we are working in, the reason that we're all here, working in health literacy, this notion of people being confused by some of that jargon should come as absolutely no surprise. And it really is one of our major challenges in terms of trying to do that translation of there's that big bureaucratic process that has kind of been built brick by brick by brick, year over year over year, to come up with this great big impenetrable fortress called health insurance. And as a process, it kind of works for the people who are in health insurance. And I don't want to throw rocks here at people who work for health insurance companies, because, you know, again, this is stuff that's been built up over years and years and years. However, it is quite a challenge, especially for those who are brand new to the notion of health insurance. It's an entirely new language. It's a whole vocabulary that has to be learned. There are processes that need to be understood so that you don't essentially go bankrupt. You select a provider who is within your network, who is outside of your network. Those have cost implications. And understanding that and making those informed choices can be the difference between whether you remain financially solvent or not. There are certain healthcare screenings and things that you are allowed to have which are free of charge, and I think if people don't know that, they might not necessarily take advantage of those.
And as I'm listening to some of this conversation, I'm just thinking about the fact that there's a real tension between what we need to tell people, so the insurance companies, the government, and all those things, and what people need to know. And it seems like no matter how hard health educators kind of fight this, that's part of what we come into conflict with, is this understanding that this is a real thing, and how you tell people what they need to know is different than how you tell people what you want to tell them. And we've had a really complicated time with that, not just with the government, but also with marketers and other people who are trying to communicate very clear messages in a certain way, but it's not the same message that I think we as health literacy communicators want to communicate. And it really is an interesting kind of struggle to get to a point where we're submitting messages that work for people.
And it's if you're familiar with the Institute of Medicine and the book they put out, gosh, it's about 10 years ago now, Health Literacy, a Prescription and Confusion. One of the graphics in there talks about the demand of the system versus the capacity of the healthcare consumer. And it's not a responsibility on one side of the equation or the other. It really is both. We are not going to be able to educate and inform health consumers enough so that they completely understand how to understand every single aspect of health insurance. Similarly, health insurance companies are not going to be able to streamline those processes so far down so that people with very limited literacy and health literacy skills are going to be able to understand exactly all of that. It's going to be a collaborative effort to find that middle ground, and we're going to need help. We're going to need navigators. We're going to need people who are coming in, assisting, working with healthcare consumers to be able to really understand that so that we can actually have some success with this and move forward. We have another person in the audience who'd like to share a story. Thank you.
I just want you to know that we are working on it. I work for a health insurance company. My name is Leslie Burrell. I do external affairs, community programming, including our health literacy program series throughout counties in Pennsylvania. And one of the issues, one of the groups that we actually focus on, and don't mind me, I'm getting over a cold, I don't normally sound like this, but is what I call the pre-senior. That's the person who's not eligible for Medicare, that they just finished working and perhaps their pension doesn't offer them any health benefits. Also, they may have children that are either in college or they're going through something or they need their parents' assistance. They've been relatively healthy people, but they may be in those kind of jobs that are, a little bit more advanced than kind of domestic, or but a little bit less than kind of super professional. They may not have a lot of savings, and they are. One of the issues with them is we were trying to educate them on and help them acclimate them to the idea of the Affordable Care Act. And a lot of these people that I'm referring to are blacks, so they like to call it Obamacare. And then when they get involved with the navigator, they find that they're not eligible for certain tax benefits. Oh, this is so expensive, I thought it was supposed to be affordable. And next thing you know, they're turned off. And we can't get them to re-engage. And then in the communities that I serve, because we don't have the wind behind our back for having a statewide kind of push to cover PA, we've got a governor and a state legislature that's against the Affordable Care Act. So we've been working uphill. We don't have it's almost like the professional capacity or wherewithal to stick with it, to keep going, to figure out ideas or groups or kind of collaborative programs that keep engaging people 10 at a time, 15 at a time, and seeing the benefit in that. That's been a really big challenge for us. I do a health literacy program series on the Affordable Care Act and how it has bolstered Medicare, and we talk about in that program some of the programs like the wellness visit, some of those things that you're entitled to. We're still finding that almost 70% of Pennsylvanians that are on Medicare are not taking advantage of that wellness visit. So it's these little things where we're trying to, at least in my fight, working with Gateway, and proud to say that I do, and that we're committed to health literacy in our communities that we service, is getting them to see that there are important parts of the healthcare bill that we can take advantage of, even if we can't get covered by something right away, and to not give up and to find a solution. That's all I want to say.
Thank you very much. I appreciate your sharing that. And you do bring up a number of very, very good points. Number one, there are plenty of examples of health insurance companies that are doing some great, great work out here. And one of the things I recommend everybody go to is AHIP, America's Health Insurance Plans. About a year and a half, 2 years ago, maybe not even that long ago, published a document on what the health the health literacy efforts that their 30 member companies are undertaking. There's a great report. If you go online and do AHIP Health Literacy, it should take you right to that particular page. Also, this is another thing that you mentioned, is the Affordable Care Act, let's face it, is a very politically charged issue. In addition to having an awful lot of difficulty on the ground level for people just to understand it, there's an awful lot of very strong sentiment one way or the other. So not only are we facing a challenge in terms of people being able to understand the basic terminology, the basic processes of how these things work, we're also facing challenges in terms of people's perception. One of the ones that you mentioned was just the different names that are given to this: Obamacare, Affordable Care Act, Health Insurance Reform, Medi-Cal, Medicaid, and in the letter that Amy was talking about, where there was a letter that said, well, you're not eligible for the Affordable Care Act, the exchange plan, but you are eligible for for Medicaid, for Medi-Cal. All of a sudden, that's requiring folks to have that understanding, those distinctions between those plans, whereas they may not have that ability to understand that. And the message that they take away from that is, I'm not eligible. Whereas they were trying to say that there's a distinction between the two.
Now, I think, too, one of your interesting points is how we are all kind of creating workarounds. So in Missouri in particular, we have this great support from Cover Missouri. That's actually funded through the Missouri Foundation for Health, which is one of the major health-related foundations in the country. Our state government is absolutely opposed to anything to do to help us with this. So we're in the middle of a Medicaid expansion challenge as well. I think yesterday in Missouri, protesters actually shut down the Senate. There's so much issue with this. I mean, this is a really big deal. This has been going on the whole year. And so the conversation about this thing, this gap, has been really confusing. And so what people are offered is a big deal. What's going to happen? We didn't even know what messages we should talk about this year, which is complicated. And then we sent out people with fairly limited amounts of training to do this work, which is a problem in and of itself. And so I think we all spent this first open enrollment period trying to just figure out how to survive and keep our heads above water. And frankly, I think we should all just say, this is wonderful, congratulations, 8 million people in spite of this. How can you even think that would have happened? And yet, we're doing the kinds of things you're talking about, tremendous workarounds, and that's even in good situations. So.
Okay, I'm going to take one more story from the audience, and then we're going to go to a couple more of our videos. Please go ahead and introduce yourself.
Hello, I'm Leslie Hickox from the state of Oregon, and I'm a combination of a health insurance agent, independent health insurance agent, but I've been a health educator in public higher education for 35 years in the states of Oregon, Montana, Chicago, and West Virginia. So I've had a lot of cross-section of health educating in the public with college kids, and I really enjoyed it and had great and tough moments. But this latter part of my career, I said I'm going to step aside and work for what I call the greater good, and that's with this Affordable Care Act. It's a historical moment, I think. And I've been serving people in Oregon with about one-on-one for about 7 months straight, working for about 250 clients now who are in 3 different settings. I got appointed by a company out of Utah to sit and write aid and be the friendly drugstore insurance woman and sit and talk to people for 6 months and then enroll them, or first step, help them apply, and then second step, help them with enrollment, which was on the computer. So you continue and you persist day by day, and you serve people. And I really looked at it as a health educating / eventually helping people get insured. And I saw it, a range of people from business owners to, last couple of weeks I served some homeless folks that came to me and we sat in a cafe and got them enrolled in Oregon Health Plan. You try to explain to them there are going to be two forks. You either get accepted with Cover Oregon and a tax credit based on your income, or you will, under this income, I was very direct about what their income had to be to qualify, and people single or families under 16 to about 25,000 would qualify for Oregon Health Plan, and they were open to both, so that was made, I think, fairly clear in Oregon. So, in terms of the dissonance that was happening, ours was continual, we're terrible on the computer. The computer isn't working. And I know this was happening in other states, but we had it kind of tripled because the private sector corporation that served us did not deliver on October 1st. And they said they were. And then there were continual glitches getting people applications directly from the computer to them. So we did paper. And I did a few hundred paper applications. And it was out of 1960 with Medicare. But I said, how did Medicare get started? It got started on paper, and over time, it's transitioned to the computer. And I said, that's what we're doing here. Well, we also had the governor going after this private sector company, I won't state who, and investigated, and now the state of Oregon has dropped that provider. We're continuing to finish our Cover Oregon enrollments along with Oregon Health Plan, but they're dropped. We will start up with the federal website this fall. But with all that bad publicity and people upset, I think that the agents, there are 2,000 of us around Oregon, and the good people at Cover Oregon on the phone, continually working. We enrolled over 250,000 people, and the people that need it are about 600,000 in the state of Oregon. So we met about 1/3 of the deadline at this point. So our goal is to reach about 95% of the population, and I kept encouraging, this is just the transition that we went through with Medicare. I almost felt like Roosevelt during the Social Security Act, you know. I can't imagine how much bad news he got. But it was really an amazing and difficult time. But we're continuing in Oregon, even with all our transition.
Excellent. Well, thank you for sharing that, and congratulations on the success and the history lesson too. It's always good for us to be able to look back and see some of those parallels. And another point that you brought up, Leslie, that I think bears reflection on all of our part is that, again, this is not only just health literacy related, health insurance literacy related, it's also technology literacy in terms of people being able to use the computer, finance literacy in terms of people being able to understand their requirements, their what they need to spend, what they how much is this going to cost, and then just literacy issues as well. So there are plenty of challenges out there. I think what I'd like to do now is go to a couple of videos that talk about some solutions, some ways that people are kind of addressing these, and then I want to have Katina and I will also share some programs that we are doing. So our next video is from Jan Thigart. She's also from the Community Services Council of Tulsa. So if we could show that video, please.
Health literacy, particularly among executives of health and human service nonprofit organizations, is one of the most difficult tasks to help them to understand how important it is. Oftentimes when we've thought about health literacy, we've thought about it in terms of chronic disease management or health promotion. But what we're really talking about now is helping those that are naive to their health care, both the insurance as well as the care themselves, preventive care in particular, how to access the doctor's office, how to utilize health care in a different way than they have before, is so difficult for the executives to understand. Because once again, we have to deploy a workforce ready to not only help the client, but also then to help each other, to support each other during this transition.
So she brings up a really great point, and before I do that, I wanted to acknowledge one of our Twitter followers who is online today. By the way, we have about 30 people who are watching the webcast, and Andrew Shaughnessy, who's a public policy manager in St. Louis, agreed with the comments made by Leslie and myself and Katina that the health insurance literacy, health insurance speak is really a brand new sort of emerging language that I think we really need to embrace and understand. This is something that we can't really ignore. It's working its way into our culture. We have to make sure that we embrace that, frame that, put that into context, and allow people to have a little better understanding of that. So much attention has been put in the media and in our conversations on this front end of enrolling folks in, and the unfortunate glitches with the rollout at healthcare.gov, and a lot of the numbers and open enrollment, and are we going to make it? Should we extend open enrollment? That we have sort of really not had the conversations about what happens again after we enroll people in health insurance. What do they do with those policies? How do they actually start to use those and be effective with those? So Katina, I'd like you to talk a little bit about a grant that you received, and then I also want to talk about a grant that IHA has received and some programs that we're starting to implement to help them along.
So you've heard me say just a little bit about Cover Missouri already, but we had a fairly major effort funded by the Missouri Foundation for Health in Missouri over the last 15 or so months. So Cover Missouri, we started with just a couple groups, like 30 or 40 people in a room, and over the course of the year, basically, we have about 435 members, I think, in the coalition right now, and they represent organizations across the state, and a lot of providers and a lot of folks. But the whole first year of Cover Missouri was focused on awareness and enrollment. We had a little bitty task force for health insurance literacy, and there were 3 of us that came to the meetings, while about 100 people would go to each of the other meetings. And so the 3 of us would sit and chat about what health insurance literacy meant. We would kind of obsess a little bit about things like, okay, fine, you get them enrolled, but what are you going to do when they don't pay their bills? And, you're creating all these email addresses for people who don't use email, and then you're going to remind them that they have to re-enroll, but they don't check their email, so how are they going to do that? And we would kind of go on and on about this, but there was nobody there but the 3 of us. Exactly. But so the good news is that the Missouri Foundation for Health took this seriously and saw this as an issue, and so they issued an RFP earlier this year, and they funded us with a couple of other community organizations to have a health insurance literacy technical support program for Cover Missouri. So Health Literacy Missouri, along with people from the International Institute of St. Louis, so this is an organization that focuses on culture and linguistics. They work primarily with people who are refugees and immigrants. So they're going to help us do some work that's very culturally specific and focused to several communities, but we'll start with people who are primarily Spanish first speaking. Also, the Mission Center. So this is a group of people who are nonprofit providers and do work in health insurance. So they're going to help us with the health insurance literacy piece and very specifically the health insurance components. And then also the University of Missouri Extension Group. So we have a wonderful university system like many other states where there's this extension program that's spread across the state and really already in position to distribute a lot of messages. They're in communities, they're in place, they've got all of these workers that are very connected, and so they'll work with us to help make sure that we get materials out. And that framework is set up to support the existing Cover Missouri framework that includes all the providers that we talked about before, also marketing and communications people, facilitators, and evaluation people. So when we put those 2 things together, it's really a pretty enormous technical support structure to help the state kind of keep moving on this. So we have a little bit of money this year, and we have 4 more years of opportunity to keep the work going. We proposed to support all of the community operators out there, so they have materials that they make all the time that they're very uncomfortable with. So one of the things that we do is we help them with the materials and hopefully help some of those forms and letters and flyers be a little more health literate. We also recognize that a lot of people in our state have a problem with written communications, and so we're going to make some videos that are very targeted and focused and very detailed. We're hearing from community members that the difference between a deductible and an out-of-pocket expense is just something people can't process. They don't even know what the words mean. So we're going to try to take some of those things apart. We're going to help the coalition with some of the social media components of the work. So we do a lot of work to other providers and people like us, but we don't know how to push that out or make it accessible to community members. So we're going to try to work on that this year. And then just, our standard health literacy messaging that we do all the time, so talking about why this matters. And that's one of the biggest challenges we face, is that there are a lot of other people who think they do this. Everybody thinks they communicate well. So we're kind of saying, yes, you do communicate well, and you're doing a really great job, but this is a really narrow lane that we have, that we do this one little thing very well, and if you could let us just support you in that, we think that maybe your messages will be much more accessible. So that's our work.
That's great. I want to share one of the programs that we're working on. While I'm going over that, though, if there are any other members of the audience who are working on any programs, whether these are just very small efforts or whether they're little broader efforts to help to demystify the jargon, the information, the terminology within health literacy, if you could start making your way through the microphone, we'd like to hear some of those stories as well. I mentioned earlier that IHA is a member of the Covered OC, Covered Orange County Collaborative here in Orange County, California. And we were very fortunate that the Blue Shield of California Foundation provided a grant to us, administered by Orange County United Way, to create 2 curricula that will help people in this whole arena. And the one that I wanted to mention right now is a consumer-facing curriculum that will explain insurance terminology, healthcare jargon, talk about the healthcare system, talk about health insurance processes, and essentially, now that you have a health insurance policy, how can you use that effectively? And to do that in very simple, plain, easy to understand language. And we're going to be rolling those, so we're creating a Train the Trainer program, and that will be rolled out to those people who will actually be implementing this with healthcare consumers. And so we're trying to go through some channels such as family resource centers, some of the social services agencies, some of the other ones that will be interacting just kind of naturally with people who are new healthcare insurance consumers, to provide those trainings and to provide on-site questions and answers after that particular curriculum. What I would like to do is invite anybody else, and there are a couple of other ones that are similar to that were posted on the health literacy listserv, but I would invite anybody else who is either aware of such a curriculum or is creating their own curriculum to share that with us, and we'd be happy to share that with the rest of the health literacy community. So I think there's an awful lot of power and strength and getting a little better results when we share what we're doing and talk about that collaboratively with one another. We have a few people who've stepped up to the microphone. If you'd like to go ahead and share your story there, please.
Hello, I'm Audrey Rithenberg. I am the Senior Health Literacy Specialist at the University of New Mexico Hospitals system in Albuquerque. And our hospital is about a 600-bed hospital. We serve in the hospital and all of our 26 ambulatory clinics. We serve the indigent population in really all of New Mexico, even though we're based in Albuquerque. Many people come to us for special services, but also just come if they're indigent. So the population that we serve is in critical need of health insurance. In the past, we've had a program called UNM Care, and a lot of the indigent population was enrolled in that. But then when the Affordable Care Act, that went away, that program went away or is being phased out. So we had the task, and I'm specifically just going to talk about what we're doing at the hospital. We had the task of telling people who had been on UNM Care that it was going away and what they could do about getting some kind of coverage, and there were several different options. So, of course, I've been in health literacy for 20 years, and I said, great, I can help you with that. And it was just reminding me when you said, Katina, let us support you in that. And so that, I went to the people who were writing the policy wonks, who were writing the letters that they were mailing out to everybody, and said, well, let us simplify this a little bit more. So we did a few iterations, and they kind of understood what we were talking about. And it really occurred to me that what we have in front of us is totally, and this has been brought up before, educating the population we're trying to reach, but also educating the people that are trying to reach out to them. And it is a special bridge that we can be in getting them to kind of talk to each other. So what happened, and we did at the hospital, we did a lot of amazing things. We have a whole department of patient financial services and people throughout the system, and including a specific office, and they worked evenings and weekends and incredibly long hours. Got a lot of people shifted over from the unit care program to whatever was appropriate. But they just kept sending out this letter and kept saying, we're not reaching those people. And they would let us adjust the letter some, but it was still a letter. It was still a long letter with, it was at 8th grade reading level, but it was still, they had all this information that wasn't really necessary. So I was advocating for, maybe we could just send a postcard that said, call us. Because we have these people waiting, ready to make phone calls and then sit down one-on-one with people. But the policy people just couldn't let go of, no, they need to know this and this and this. Well, maybe they do, but not now. So I think health literacy practitioners can really be that bridge and help people understand that there's a time to give them the information and when you really need to focus on what action do you want from them. All we wanted was for them to call. And once we got them on the phone, we could say, okay, here's what you need to do. But we couldn't get them to that point because we couldn't get them to let go of their language. Right. So it's an interesting challenge.
Yeah, thank you, Audrey, for sharing that. I mean, and you bring up a couple of really good points. It's this notion of we really need to be collaborative in this entire process. We need to be able to work with those whose awareness of health literacy, what the reality is out there in terms of the consumer's ability to understand, is very limited. And so part of our role within this health literacy community is to raise that awareness, is to let people know we have an awfully complex message that we are trying to communicate to a group of people that have a very limited capacity to be able to interpret, understand, and apply that information. So our messaging is very, very important. How we present that message, the number of messages that we present, and the way that we do it in a way that meets the most immediate needs right now. It's very difficult for any of us to be able to deal with the immediate and the required versus that long-term and those abstract kinds of messages at the same time, and to be able to do all of that very, very effectively.
And also, as you were talking through some of your issues, it made me think of one of the problems that we keep hearing about, and the marketing people and health literacy people kind of agree that we think differently than the policy people. And so when we made our changes to some of the forms, we would get them back and they would never get changed. And we would hear back from the policy people that there was a question of accuracy. And so sometimes the policy people would think things were less accurate when we made them more simplistic. And so there's this debate about what is real and what is true, and what is accurate and clear, and what level of complete information has to be provided in every message to call it accurate and appropriate. And that's just a different conversation. And I think that sometimes we're not in a place that we're comfortable having that conversation. There's maybe some power differentials between us and the policy people, but it's complicated, and I'm glad to hear that other people are finding similar experiences and work-throughs in other places, so thanks for sharing.
And we're going to get to a couple more stories in the audience in just a moment, but there's a couple quick videos that I want to get to that talk about this very issue of perception. And one is a very kind of a poignant story that's shared by somebody from your state, Graham McCauley, who's from the University of Missouri Extension. And this gets to this notion of health insurance literacy, and especially in terms of the terminology, people being able to understand it. So could we get that video from Graham here, please?
Hi, I'm Graham McCauley with University of Missouri Extension, and I've spent the last year working to launch a health insurance education initiative. We developed and delivered curricula to provide politically neutral, fact-based education to help individuals, families, and employers to better understand the ACA, clear up confusion, and understand their health insurance options. And by the end of open enrollment, several thousand Missourians had attended our workshops and outreach events. However, we know the best intentions of educators as well as policymakers, navigators, insurance brokers, and other organizations are lost if consumers do not only value having health insurance coverage, but also have some level of health insurance literacy. And we're now expanding our efforts to integrate this literacy information into our education, including how to select the right plan and using it correctly. The need for this was reinforced to me a couple months ago when a local reporter contacted me about a story he was doing on a couple who had purchased a plan through the marketplace. And this couple believed their personal information had been sold to a company that was fraudulently opening bank accounts and trying to extort money from them. I did some research into the situation and found there was major confusion on their part as well as that of the reporters, who was originally going to run this piece as an Obamacare scam story. It ended up that the couple had actually purchased a plan from the marketplace that had a health savings account attached. And even though their plan name said with HSA in the title, this was not clear to them, and they believed the third party administering the HSA was trying to scam them. So we know that we have our work cut out for us in clearing up confusion, especially for those who have little experience with health insurance.
This is a great point, and this is it's one of the many, many very sad and tragic kinds of stories that we end up hearing about. People who, let's face it, we have a very diverse society here, and anytime anything just goes a little bit left or right of people's perception or understanding of the direction that something should go, a lot of times people will immediately jump to a worst case scenario, and in this case, and we actually looked at the video that was the news station that ran this, and sure, the couple had signed up for this plan that said with HSA. Now, those are three very simple letters, and if you didn't stop and question what that was about, that adds a whole additional component. And HSA, as you know, is not necessarily a health insurance policy. It's a savings account that allows you to pay for your health care. So the fact that they misunderstood that, or that it wasn't adequately explained to them in a way that they really actually knew that, created not only confusion but also fear, just anxiety, and a notion that not only did I not get the health insurance plan that I wanted to, but that I'm being scammed. And this is something especially for the vulnerable and those who don't have the tools and the ability to just get insurance through an employer or something like that, where they have to go out and do that. This can be very damaging. This can be very oppressive and just a horrible kind of a situation. I want to look at one more very, very quick video, but the one thing that I want to make sure that I tell everybody in our audience is that we have our poster session tomorrow evening from 5:30 to 8, and there's a separate section in the poster presentations on this exact topic, on the Affordable Care Act and health literacy. So I encourage all of you in the room to make sure that you attend the poster session to see all the posters, but make sure you look at those posters in particular. Can we, and I promise we're going to get to you guys very shortly, can we go ahead and roll the video with Diane?
Hello everyone, my name is Diana Pena, and I'm a Certified Enrollment Counselor and Health Resource Specialist for the Institute for Healthcare Advancement. While I was working as a Certified Enrollment Counselor, I began to notice that a lot of the appointment time was being used to help the consumer understand different health insurance terminology. And it was important to spend this time with the consumer so that they can properly pick a health plan that would best benefit them. But I began to wonder if this was just a problem that new consumers were having, or if it was a problem that the general public was having. So I decided to construct a survey at a local resource fair in La Habra, California. The survey was to test whether these consumers can define 5 common insurance words. The insurance words are coinsurance, premium, deductible, benefit, and copay. The survey showed that 88% of these consumers could not define coinsurance, 65% could not define premium, 38% could not define deductible, and 30% could not define the word benefit. The most common word that people could define was copayment. From this survey, one can infer that more formal research is needed in this area to help highlight the importance of health literacy. Thank you for your time.
And one of the things that Diana is referring to, there's actually another study that I just wanted to mention, and we're going to have a link online afterward to that. It's a study that was done by Robert Wood Johnson Foundation, and there were a couple of other ones. but it really says, it really kind of reiterates those same points in terms of people's inability to understand those basic terms. So when we're talking that language, it just further complicates the situation. We have just a couple of minutes left. I'd like to go ahead and go to one of our stories here. For those of you who are in line, if we don't get to you, is Helen Osborne in the room? Helen's going to pull you aside and get some of your stories, and we're going to go ahead and capture those, and we'll put those online as well. We want to make sure we give each of you a voice and an opportunity to be heard. But go
I'll
ahead.
be quick, I promise. My name is Laura Ross-White. I'm with the Community Service Council in Tulsa, Oklahoma. You saw 2 videos from individuals that are my peers and coworkers, but wanted to give, they've kind of told some of the challenges, but I want to tell you a little bit about how collectively we've tried to impact this in a different way as a true cross-sector collaboration in our community. We really have, over the last 18 months, done 153 presentations to professional groups about the Affordable Care Act, really stating the fact that we cannot just talk to consumers, we have to talk to everyone. So we really, with church groups, schools, communities, libraries, we have been everywhere across Oklahoma making this presentation. We were a recipient of a DHS grant for social marketing for the Affordable Care Act, and we have put those on every bus shelter, every taxi bench, everywhere you can find in Tulsa, so that we can start teaching people those very basic words of insurance, copay, deductibles, really taking it down to the very most basic level. We did a cross-sector for about 9 weeks of a Marketplace Monday. We coined it, and it was locations across Tulsa, 4 of them hitting every geographic area that we could, week after week, trying to get enrollment. And with that, we continued doing educational events and promoted them at the enrollment, so that we were leaving people empowered that they're going to come back and listen and learn more about how to use their health insurance. And those educational events have now spanned to where we're doing those for the primary care clinicians and nurses, so that they are getting the very same message as our community is.
Thank you so much. And we have time for just one more if you want to come up very quickly.
Thank you. Hi, I'm Kelly Ham. I'm from the National Network of Libraries of Medicine, and we're funded by the National Library of Medicine, based at UCLA Biomedical Library. And I just wanted to mention the role that public libraries have had with the Affordable Care Act. Back in June last year, there was a national program at the American Library Association that started everything rolling, and from there, the Centers for Medicare and Medicaid Services were part of that program, and then others that, the players. So trainings happened all over the country. There was a national training organization called Web Junction, which created a community of libraries and a resource called Health Happens in Libraries. So that started the ball rolling, and then the NNLM, my organization, provides training for public libraries around the country, and this was such a huge focus, but all of the libraries had to do this without any extra funding or training when they started, and but the library is a trusted place, so people in the community come in, they are able to use the computers for free, and so it became the place where the navigator organizations would come, and they would have these public events bringing people in from the community, and it just has become kind of the go-to place for the people who are disenfranchised from other organizations, because the library is their trusted community place. And so I'll be here, I'll have an exhibit booth, so I'll be here the entire time if anyone would like more information about making those connections and partnerships with your libraries, because I know several of you are from organizations where your public library may be someplace you haven't thought of as a partner. Thank you very much.
Thanks, Kelly. And I do want to give a big shout out to all librarians and libraries across the country. Not only have they been great partners with all the organizations implementing the Affordable Care Act, but just essentially great partners with all of us in terms of health literacy, providing materials, direction, education, resources to try and get those health messages out. So thank you very much for sharing that. Katina, any final thoughts before we wrap up?
Sitting here listening to this conversation for the last hour has just been really exciting. As you hear all of us talk about what we're doing, there's a remarkable consistency in our strategies, and so that kind of says to me we're on the right track, we're thinking clearly, there's a lot of collaboration here, and what we're doing is the right thing to get the message out in a very dynamic and powerful way. So thanks for sharing that, and it's really fun to be part of it with you.
It is, and I think another takeaway for myself is that the challenge for all of us as health literacy professionals is to understand that this is, in a way, really no different from the other work that we're doing in terms of getting clarity and understandability and usability in any of our health messages. The healthcare system is remarkably complex. The health insurance system is remarkably complex. It is our responsibility to come up with some of these innovative ways to demystify this process, to get people so that they can understand and use these messages, so that they can care for themselves, so they can care for their loved ones. There's an awful lot of programs out there. Our conference hopefully is one source for providing some information on all of those. And collaborate, work with one another, understand that your consumers need to be reached out to, spoken to, asked if they understand, and find out what materials are working for them, what isn't working, and really work on that that testing process so that you can really get to the point where you can say, okay, I feel confident that this piece or this approach is really helping people to understand and use this particular process. I want to thank the over 40 people who have joined us online for this session, everybody who is in the room here, Katina O'Leary from Health Literacy Missouri, Michelle from Health Literacy Missouri, my staff, Amy, Mario, and Adriana, and the Hotel Irvine for sponsoring this event. So from IHA, thank you everybody, and good afternoon.